All right, welcome to Amazing People, episode 5. I'm here with Dr. Sam Atallah.
Hello.
Dr. Atallah is a colorectal surgeon. He went to Harvard.
I did do some research at Harvard for a year. I started molecular genetics and those areas in biology before, and then I left Harvard to work on the Human Genome Project before going to medical school.
Okay.
So from there I hopped on and went to, I was doing research at Southwestern Medical Center, and I went to medical school there in Dallas, Texas.
Okay.
And from there I did my residency for the most part in Houston at the Texas Medical Center and MD Anderson Cancer Center.
Okay. What do you think about the medical profession? Do you recommend it for people?
People say to me, is this something you would do all over again? And ultimately, I would say absolutely yes.
Mm-hmm.
Sure, there are shortcomings, and in some ways you feel like the whole system is collapsing before your eyes. But the fact of the matter, it's a privilege to be a physician. It's a privilege to take care of patients and to do the things that we do day in and day out. It's phenomenal. To do surgery is a dream, and it's a privilege. And truly, there's nothing in the world I'd rather do. I would do it all over again. So I think, I encourage young prospective physicians not to be disenchanted by some of the challenges of medical care that we're facing. And ultimately, if you feel that you're passionate about taking care of people and you're passionate about making that your career, then you should.
How do you manage to balance your life with your work? Because I'm sure there are a lot of interests that you may have. Maybe you're a writer or an athlete.
Sure, there's a lot of things that I balance, and as the older that you get, the more that you have to balance. I remember being a medical student, single, no children, no real responsibilities except my own education. And I look back and say, wow, what were you so challenged by? Because the older you get, the more challenges that you have, and there's more in life to balance. So the things that I have to balance, I'm married, been married for 19 years now. I have 4 children. The oldest is now graduating from high school, and the youngest is just 7 years old. And so that I usually tell folks, there's never a dull moment. There's always something exciting going on, and there's such a great dynamic, and so much, you can focus your whole life just on one child and never really feel like that's been fulfilled. So to have 4 of them and to be married and everything else, plus juggling friends and things like this, that's just one aspect and element of life. As a hobby, I'm actually a musician in a band, and we play out a couple times a month, and so that also keeps me busy. But beyond this, I also am very active in research. And since 2010, I've published about 80 publications in peer-reviewed journals, and have authored several book chapters, and I'm currently actually writing a book on what I'm most passionate about. It's an area in colorectal surgery called TAMIS and TATME. And those are areas that I've helped shape and pioneer, and TAMIS is one that I've actually invented with a couple other surgeons. So that's kept me very, very busy and kept me traveling all over the world to sort of teach and train other physicians, other surgeons who do colorectal surgery about these techniques so that they can adopt them into their practice. To give you an idea, in 2017, I traveled to 16 countries on every continent except Antarctica to teach, train, and show surgeons about these newer techniques that we're doing right here in Orlando.
So what gives in the work-life balance aspect? Because you've got the band, you've got the kids, you've got the travel and the product and the research and the job.
Right,
so
and the job.
Is it sleep? Is it exercise? Is it extremely good time management? How do you fit all of that into the 24 hours?
Well, I think it's a lot like juggling. And when you learn to juggle, you can only handle 1 or 2 balls at a time. But as you become more skilled, you can suddenly, put 6 or 7 or 8 balls that you're juggling all at once and seem to do it flawlessly. Certainly, I wouldn't say I do it flawlessly, and if we had the juggling as an analogy, every now and then a ball hits the ground, because you can only juggle so much at a time. And the things that beyond my job that are priorities is certainly family first, but also patients first. And so it's very important that you spend the time and care about your patients, and you spend the time and take your job very, very seriously. So while we may have, as surgeons especially, we may have light moments where, we have fun, we socialize, we spend time with our family, we get to do cool interviews like this. But when we're at work in the operating room, we're so focused on what we're doing that nothing else in the world can take precedent over that. And so there are times that when we're not really juggling all those elements at once, and you're just focused on your career, your job, and what you're doing at that moment. So, but I think that the more you have in life to balance out, the more of these balls that you're juggling, your family, any activity that you do, traveling around the world and meeting other colleagues and discussing new surgical techniques and innovations, all those things enrich your life in such a fantastic way that I wouldn't do it any other way.
There are a lot of people who struggle with motivation. Probably more so younger people, but I wouldn't be surprised if older people do too, especially younger people who are trying to find their place in life. And because they don't have a motivation or a sort of purpose, they may sleep until 2 p.m. and just have weeks waste away. When you were younger, what was it that made you decide that this medical path was it for you?
I think you have to do, as a young individual, you have to do a lot of soul searching. You have to know it's normal to struggle with this question of what is your purpose on earth? What are you really here for? What are you here for? Did you know that when you were 7 years old? Did you know it when you were 10? When did exactly that come to fruition, that you knew what your future was going to be, no matter what your career is? And so it's normal to have some days, months, maybe even years doing that soul searching to find what you're most passionate about. I can tell you, I didn't always want to be a surgeon. I didn't always want to go to medical school. And it was something that I found through experiences in different avenues that suddenly I realized that was my calling. Once you know what your calling is, suddenly those days of wanting to just sleep until 2 o'clock in the afternoon or stay up all night doing mindless activities suddenly change, because you feel you have a purpose. And so when you have that purpose, you want to take it on and you become passionate about it. If you are in any type of career and you're not passionate about it, and you see that as more of a 9-to-5 job where you're not really excited about being wherever you're at, and you're just waiting, counting the minutes on the clock till the 5 o'clock buzzer goes off so that you can enjoy the weekend, then you're not living life. I mean, life is about a balance, and sure, weekends and time off and these sorts of things should be fun for us. They are a lot of fun, but what you do as a profession should be just as fun. You should be just as impassioned about what you do as a career as anything you do socially.
So I know that a lot of doctors are unhappy, and I know a lot of people in general who are at their jobs are unhappy. And the thing that I think can be very helpful to that is to focus extremely hard on what you're doing at that moment. Right? There are more dimensions to what's happening than just the physical activity. If you focus more on how the colors look, if you focus on other things, it gets rid of the mental tension. Mm-hmm. How do you find that you maintain the happiness in a stressful career?
Well, I think you hit the nail on the head. I do think not every physician would say what I'm saying to you, that I would go back and do it all over again. I don't think that's universal, and I think that it's easy to become disenchanted. Again, medicine is a very broad spectrum, and it's a different life altogether, perhaps for a pathologist, for example, or a radiologist, where those are great specialties, but for me they wouldn't be fitting because they lack that personal communication, where you're basically operating on your own and you're not really communicating with the public, with patients. And that would be something that for me would be missing. Another example, for example, would be physicians who go into emergency medicine. Emergency medicine is a high demand specialty. It's also well sought after, so that if you graduate with an emergency medicine degree or after completing a residency, you'd be in very high demand because we need physicians like that. There's a problem though, is that it has a high burnout rate. And to me, one of the reasons that may explain that is that there's not a continuity of care. So I think I always feel very lucky because I'm in a profession or a branch of that profession, which is colorectal surgery, where I get to experience all these things that just make me happy and want me to keep on doing it day in, day out. And that is patient interactions and the types of surgery that I get to do, the types of interactions which include beyond just in the clinic and in the office, but also can extend to the ICU and on the wards and everything else that comes with that. So for me, it's a very fulfilling career. That's what I think all young professionals who are thinking about careers should think about is ultimately, will you day in and day out find this career rewarding enough so that it fulfills you? I can't tell you how special it is to be able to connect with people, to know that patients and their families really appreciate what you've done because you did work hard, you did sweat a little bit in the operating room doing a complicated operation. And if you can make one or two people very happy, and if you can save their lives, you feel fulfilled inside. And that's a feeling that is, it's almost addictive. It's something that you start to want. And the more you want that, the more you want to do it. And it drives you to work harder.
And push through pain. It's like when an athlete gets used to winning.
You push through the pain, right.
Yeah.
And so, and listen, nothing good comes without that push through pain. I believe that. Athletes go through it. You want to show results, you got to work hard for it. And so the medical career is very demanding from medical school on. You spend hours and hours reading and you don't stop. One of the lessons that I was, as a medical student, is trying to drink this fountain of knowledge. It's like a fire hydrant coming at you, and it's a lot of volume of knowledge to soak up in a short period of time. And one of the great physicians of the time in internal medicine, Dr. Foster, who passed away recently, used to say, listen, when you get out of medical school, don't think you're done reading and learning and things. You got to keep at it. You got to continue to learn. This is just a starting point. And I was just thinking to myself as a medical student, oh my gosh, I don't want to have to ever, pick up another journal, read anything. But it's absolutely true, and I still do that. And you start to find motivation that comes from what you do, so that you don't see it as a chore, but you actually enjoy it.
How long are you going to keep doing it?
Forever, as long as I can. Right.
How do you handle the pain? When the pain comes? So do you have to just push through? Do you drink coffee? Do you remember the patients you've saved before?
Oh, geez. Well, first of all, I live off coffee. Yeah, I think that you have to build a tolerance, and I don't really think about it that way anymore because you build, as athletes would term it, endurance. So if an athlete is just, for example, let's say I'm a novice athlete, I'm going to go run 10 miles. I'm not going to do so good. But if I gradually work up to that, then running 10 miles will not challenge me so much, and it'll become my new endurance. And that's the kind of thing that in medicine, we do work long hours. We're always on call. I've been on call for 65 days in a row now, and I can do it because I'm not so much that I'm numb to it. I've built an endurance, and I can manage my life in such a way that it doesn't become an obstacle, and I don't mind at all.
Emotionally, what's it like when you lose a patient?
It's absolutely the most horrible thing on earth. It's absolutely horrible. And
does that affect you at night?
It affects you. It ages you by 10 years. Yeah, it absolutely affects you when there's an unexpected outcome. Clearly, that does not happen often. It's a rare event, but it doesn't matter. And you'll wake up in the middle of the night in a cold sweat. You won't be able to sleep. You'll go into a depression for a while, and it is very, very difficult to undergo that, to experience that. It's just, sometimes it's I would say it's the hardest part about medicine, but in a way we need a challenge. We need to experience all the medicine with all its ups and downs, and usually, fortunately, for every down like that, there's 10 ups or more. And so in the end, it balances out that we end up feeling in the end that for the most part we're helping people.
Healthcare is obviously important, and it's an issue in the country and in the world. What do you think about programs to extend it to more people, whether it's in America or abroad? Because when somebody doesn't have healthcare, it can completely ruin their life. Now, the ways in which to actually extend it, people disagree about that. What are your opinions on that?
Well, I mean, I'm not a politician, and I can tell you that it's a difficult problem. However, I do believe that it should be extended to all of us in America. We already somewhat have a model of health care for all. It's just under the Medicare auspice. And so in other words, once you reach 65, you pretty much are granted medical care that's more or less paid for by the government in a one-payer model. And the question is, can we bring that down in a way that is affordable and doesn't bankrupt the government, et cetera, and still have everyone insured under that umbrella? I think worst of all, what I don't want to see is young children uninsured. And I think that there should always be a policy to protect those who are not of a working age, so those who are under the age of 18, they should all be insured. But now I don't want to get into a political soapbox and things, and I think it's complicated, but despite it being complicated, other countries have made it successful. For example, our neighbor Canada, and most of Europe. So there are models that work, and I think that it's evolving.
One of the reasons that people have health problems are sometimes come way down the line, and they seek cures rather than taking preventative measures to begin with. And I'm talking about common sense ones like fitness and diet. And in this country, according to the CDC, 40% of people are over 20 are
obese,
which leads to a host of problems. And in many cases, that can be easily curtailed through proper diet, proper exercise. What do you think about preventative care, not necessarily in the medical system, but what are the common sense and tips you have for the population?
I think you said the word, it's common sense, but it's harder than that because we have to change a culture. So you, for example, may be more intellectual, you may be more cognizant of the difference between healthy, not healthy, but you may not represent America as a whole. And there is, I would say, perhaps the large majority of America that is not as health conscious as you might think. And remember, America is, correct me if I'm wrong, I think about a 25, maybe 30% college education level. So in other words, not most have been through, college education to know kind of basics like this, and may or may not know the value of eating healthy, or may not know, what the difference between health food and not health food is. And as you know, in this country, even today in 2018, it remains that fast food is rampant. There's a lot of unhealthy fast food still out there, and we haven't quite seen that revolutionary change in people trying to eat right, except for those who are educated and aware of the health and nutrition, or actually care about it as well. And so I think that our biggest problem then is is a culture of wanting to change that and caring enough about your health. Okay, so you and I, we care about our health. We don't want to be overweight. We don't want to eat wrong. We want to eat healthy. We want to watch our cholesterol as we get older. We don't want too many sugars and things like this. But the more we talk about it, the more campaigns there are, the more we are a public voice, then hopefully we can change those cultures and improve American habits and improve the enthusiasm for health maintenance.
I think that it is a huge national concern of orders of importance that are hard to see on the surface. But when you have a lot of people who are unhealthy for ways that are preventable, their motivation goes down, their ability to do productive things goes down, to spend time with their friends and be happy goes down, and they instead find themselves having to get a lot of health care, which then ends up swelling the amount of government expenditure on healthcare. And if we could all just take more of the common sense things, that could prevent so many of the things that may be bringing people into your office.
I mean, I 100% agree.
What are you suggesting in terms of?
Well, I think you're right. We can't, say you're going to have your colonoscopy on this day because everyone turned 50, and we're just going to screen everybody, and we're enforcing it by, law. Of course, that's never going to be. What we're really looking for is everyone to get that suggestion so that they're encouraged enough to want to do it on their own volition without somebody kind of forcing them into something like this. And so I think it's how do we suggest it in a way that
it's not browbeating.
Right.
And it's maybe positively motivating.
Right.
But it will still fall on a lot of deaf ears.
You're right. I mean, so an example of that would be, for example, you and I, and probably everyone watching this, has seen some commercials on television where someone had throat cancer, and it's somebody speaking
with the robot,
with a robot voice, and it's very morbid, but also catches your attention.
I saw one, I think, today.
Yeah. And does it not get your attention, and do you kind of not look down on smoking? And I think, I mean, I don't smoke, and I would assume you don't smoke either. But if you did, that may be a powerful motivator for you to think about, man, maybe this should be the day that I quit. I don't know. But I think that those sorts of things, because they're real, can be strong motivators. And these are real other citizens being affected with things. And I think, we're keeping on a personal level rather than a government mandating that this will be done because we think it should be done. It becomes more of a personal thing.
Well, there's no exact science to motivation, but positive motivation in a lot of ways works better than negative motivation does. But at the same time, because let's put yourself in the shoes of a smoker who's seeing the commercial. They might think, well, I don't want to be like that, but that might be 10 years off, and I want to enjoy my life. And I've always found that I want to enjoy my life argument for bad health habits to be
a number one argument for them.
It's a number one argument, and it's also it doesn't actually make sense because you don't enjoy your life, right? When you're ingesting bad things, not exercising, that's the best way to not enjoy. It's superficial, it's short-term gratification, but
that's what they believe in.
As the body degrades, though, you become addicted and unhappy. And the hard and better and happier, more happiness-inducing path is the one in which you take the short-term pains, like you do when you're doing surgery, when you're studying extra hours, to then do things that are good and productive for others and for your own self, and to see yourself be able to run longer. I think that could be a more, done correctly, that could be a better advertisement than the throat robot thing.
Yeah, I think you make a good argument for that, for sure. I do think that breaking addictions and things like this and adopting good patterns of good health, they do take a sacrifice because, yeah, everyone likes, for example, the taste of fast food or junk food, so let's call it that. And for those that smoke, they like that short-term buzz or whatever they get off of it, and so on. And so, but it takes, true motivation to see your life not just as a few years. And I think that's a mistake of the youth, is young people usually cannot envision themselves as older people. And because there's such a distance between the future and you now, for example, that you may never think that you just cannot realistically think about the future in that way. You cannot think, well, what happens when you're 40? What happens when you're 50? How is life going to be like when you're 60? Because many youthful people spend their time focusing on one thing, is that they just want to live the best life they can in their 20s and maybe 30s, and then the rest of the life is kind of over and we'll look back, or I'm not exactly sure what the mentality is, but they don't have a good vision for themselves that's positive beyond the youthful years.
And so what's the drawback there? Is it the bad health habits? Is it the poor planning for when they're 30 and 40? Because there's something to be said about being spontaneous and.
Oh, sure. I mean, you should listen. I mean, youth is fantastic, and it comes with not being wise all the time and being spontaneous, and those are good moments to have in your life history. But you also have to have a timetable for your life that takes into account the future. And not just say, well, yeah, maybe that'll be me 10 years from now. Who cares about 10 years from now? Because 10 years will come at one day, and then you'll wonder what happened to you. And then you'll become someone that perhaps you never envisioned.
And then when you become that person, let's say you end up becoming obese, and let's say you smoke, the two examples,
right?
And you're addicted to fast food, addicted to cigarettes. You've now become that person, and you'll do what you can to defend those habits, like the I want to enjoy my life mentality. Whereas had you just taken a different path, say 10 years earlier, this is the obese smoker, and this is the healthy athlete. Same person, different life paths. But this person thinks they're this person, though, without realizing they could have been this one. They could have been the fit, healthy person.
Right, and every now and then that person starts to realize that, wait, there's an alternate path for me, and I could have been this slim, healthy person. And that select few say, I'm going to do an about face, I'm going to stop what I'm doing now, I'm going to eat healthy, lose weight, stop smoking, and they turn into this thin, handsome man or something, because out of real effort and out of a conscious decision, that can be broken. So it's not the end of the world if you ended up on that track. You can correct that. You can correct so many things. But you're absolutely right that when you get that far down, many people in that pathway would say, well, this is my life and this is who I am, and I'm going to accept this, and this is, I'm not going to worry about it too much.
I'd say whoever you are is never totally fixed. A person can change, they can make a huge change in 1 second, and then keep on building on that, and then
the hugest change to make in that 1 second is a mental change. It's not a physical change, it's in your mind. And you have to find the conviction that you're not going to continue on this path. You're going to find a different, better path. That, I think, is the hugest 1 second change that you can make. It's in your head, in your mind, and when you find that and you stick with it, I think it makes all the difference in the world.
I think it requires that 1 second, a lot of times just gets muddled out by all this other stuff. I think it requires a little bit of focus and forgetting who you are now. If you're the obese smoker, forgetting that you're that person now and just imagining what if, and really going with it, because this is a mental thing.
For sure,
right?
yeah.
And I think the reason that a lot of the people who do not change their habits when they find themselves in this bad spot is because they're like, forget it, who cares? They feel guilty. They're like, I guess this is what I am now. And if they think about the other image of themselves, they might not be inspired. They might feel bad. Dang it, well, guess it's not me. Let me smoke. It'll make me feel better. It's sad, but I think we can all change it. I think we can change it if we just have the right stuff going on in our heads.
I think if you put all the elements in your head and you can sort out all of that, then you can move forward and you can make a change that's positive in your life, for sure.
What do you think about humanity in terms of the going forward with the future?
Well, I think there's always going to be a humanity, and I don't, despite us becoming more AI-centric, more computer-centric, and despite the lack of, in some aspects, one-on-one communications like the one we're having now, having conversations, I don't think will completely be a thing of the past. And the reason of that is that there is something to being human, and there is an aspect that's fundamental to medicine, and that's humanity, is that we actually ultimately care about one another. If I was operating on a Meccano set or, a lab rat or something like that, it's not the same effect as when you're operating on a human being, because there is something to being human.
Right.
And I think medicine is a great example of that, because no robot can give you that sense of humanity almost by definition. And so as things change in the future, as we see more automation, and despite us seeing less one-on-one communications like this that we're having, and people, as you know, always Snapchatting and texting on their phones, and a more disengaged type of a relationship, if you will, I think that there's always going to be a need for humanity. I think there's nothing like the human touch, a pat on the shoulder, a hug, a thank you, those sorts of things define who we are.
The reason that the more immediate technology interactions are so popular and are kind of overshadowing human interaction is because they're immediate. You always have it, and there's a distance between you and the other person, so it's safer.
Right.
And I think that the way to beat that and to bring back the one-on-one interaction is like what you said about the lab rat versus the human, right? You're going to be driven more. You're going to study longer when you know there's something really important happening with the human surgery. Similarly, the deeper, higher, better thing that happens with real interaction can win if people feel that and know what one feels like compared to the other. That itself also, when people are more connected with each other, truly connected. And I think that the technology does help connections, and then it also helps it lack of connection too. The more connected people are, the better everything becomes. The more we care about each other.
Right. I mean,
which leads to geographical, societal, national, better things, a better world.
Oh, for sure. And I think that, digital ways of connection through social media have changed the landscape of the planet, and truly, if you can say, have made things more global. They have. But when we try to divorce ourselves from human interaction and instead become attached to less direct, disengaged forms of communication, then I think it can backfire and be a bad thing. And in that way, some types of media communication are not always healthy. And I think we have to always remember that there is something to being human, and it's the most important element that keeps us together.
Is that your favorite part of the job, the talking?
Absolutely. I love communicating, chatting with patients, and being able to have the privilege of operating on them, for example, to remove cancers and potentially curing them of something like that, and to have conversations before and after surgery, and to see them along the way in life is it's the most rewarding part of my specialty.
Well, thanks to you, we have, I'm sure, a lot more humans that are still here who can be having human interactions and human touch and part of the big humanity. So thanks for coming on the show.
Thank you very much.
Really appreciate it.
Great time.